Malaria is a mosquito-borne infectious disease caused by Plasmodium parasites and remains one of the most severe public health problems in Africa. The persistence of malaria in Africa is primarily due to a combination of biological, environmental, and socio-economic factors, and it inflicts heavy health, social, and economic consequences on human populations. In 2022, the continent accounted for about 95% of global malaria deaths, with children under 5 being the most vulnerable group. Causes of malaria in Africa. Biological factors. Plasmodium falciparum. Africa is home to the deadliest malaria parasite species, which is responsible for the majority of malaria cases and deaths on the continent. Efficient mosquito vectors. The African region has some of the world's most efficient mosquitoes for transmitting malaria, particularly the Anopheles gambia complex. The adaptability of these vectors and the parasite has allowed them to develop resistance to insecticides and anti-malarial drugs. Environmental factors. Climate conditions. Tropical and subtropical regions of Africa provide ideal conditions for mosquitoes to breed, with warm temperatures 15 to 40 degrees Celsius, high humidity, and high rainfall. Climate change is expanding transmission into new areas, including higher altitudes, putting additional populations at risk. Stagnant water, water that does not move from lakes to puddles and man-made reservoirs, serves as a breeding ground for mosquitoes. Seasonal variations in rainfall can lead to spikes in transmission. Geographical factors. The location and altitude of human settlements can affect mosquito breeding habitats, leading to varying risks of transmission. Socioeconomic factors. Poverty. Malaria is highly correlated with poverty. Poorer households often live in less protected housing, have limited access to healthcare and preventative measures like mosquito nets, and may work in outdoor professions like agriculture that increase exposure. Population movement. High levels of mobility among vulnerable populations, including refugees and migrant workers, can spread the disease and interfere with control efforts. Weak healthcare systems. Many African countries have limited financial resources for their health systems, leading to inadequate supplies, low staffing levels, and poor access to facilities, especially in rural areas. Conflict and instability, wars, and civil unrest can lead to the collapse of health systems and mass population displacement into camps with conditions favorable for mosquito breeding. Consequences in human populations. Health consequences. High mortality rates. In 2022, 76% of the 608,000 global malaria deaths occurred in children under 5 in Africa. For countries Nigeria, the Democratic Republic of the Congo, Niger, and Tanzania accounted for over half of global malaria deaths. Severe illness. Malaria can cause severe complications, including cerebral malaria, blocked blood vessels in the brain, organ failure, severe anemia, and respiratory distress. Impact on children and pregnant women. Young children and pregnant women are the most vulnerable due to their underdeveloped or altered immunity. For pregnant women, malaria increases the risk of maternal anemia, miscarriage, stillbirth, and low birth weight. Cognitive impairment. Malaria infection in children can delay key educational milestones and impair cognitive abilities. High case numbers. The WHO African region has the highest number of reported cases, with countries like Uganda, South Sudan, and Burundi reporting over 250 cases per 1,000 people. Economic consequences. Reduced GDP growth. The disease has been shown to reduce economic growth in endemic countries by affecting labor productivity, tourism, and investment. Increased household spending. Families must bear significant costs for prevention measures, drugs, and treatment at clinics, consuming a notable portion of their income. Lost productivity. High rates of illness cause absenteeism from school and work, especially in the agricultural sector, which impacts household income and national productivity. Strain on healthcare systems, malaria prevention and treatment consume a large percentage of national health budgets, diverting funds from other essential services. Social consequences. Exacerbated poverty. The disease creates a vicious cycle of poverty, where families become poorer due to the economic costs of illness, and their impoverished status increases their risk of contracting malaria. Human capital deficit. The disease can lead to a long-term deficit in human capital, as high absenteeism and premature mortality affect educational achievement and the future workforce. Inequality. The malaria burden disproportionately affects the most marginalized and vulnerable populations who have the least access to healthcare and preventive measures. Impeded development. By hindering individual well-being and economic growth, malaria interferes with socioeconomic development and perpetuates health inequalities.